when I was diagnosed, it was like, okay, I have this devastating information. Now what do I do with it? I was shocked. I was frozen almost. And after you speak with the doctor, one of these little angels, what I call, they're nurses or nurse practitioners or whoever's working on the team, moves you along just through it. They take care of you because you don't know what to do when you have cancer. What test do I need? What do I do now? Do I need a biopsy? And they walked me through it so easily. And I'm such a controlling person that I wanted to kind of grab onto it, but it was out of my hands and they just took it from me and walked me through every step of the way through it. With all that coordinating and all the doctors and the doctor's appointments and tests, it was never overwhelmed because I had my game plan structured for me step by step, where I would have to go here, what would be done, then I would move on to this next step, and so on and so forth. And I completed my full reconstruction, tattooing and 3D tattooing by one of the greatest ladies, Renee. She completed me just this year on December 1st. And it was, when you go from a clean slate, nothing, it's all gone, and they built me up to more than my wildest dreams. I never thought that I would look normal again, or I just never had expectations, because I thought that having my breast completely removed and having everything gone, how was I ever going to look normal, remotely normal, let alone 100% normal? And this year I did that. And like, I'm getting teary now. When I looked in the mirror after having the tattoos, a 3D tattoo put on to replace my nipple and everything, I just broke into tears. I wasn't even expecting it. I looked in the mirror and there I was, normal again. And it's fabulous. It's really wonderful how I look. Actually, I was diagnosed about a year after moving to Charleston from New Jersey, 20 minutes out of Manhattan, where some of the best hospitals are. And that was one of the reasons why we moved here to Charleston, because of the MUSC and the reputation that it had. Their objective is to keeping you alive and to make you feel whole again and to make you feel normal. They're going to do their best to make you look normal, and for your own self. It's not like having an eye, having your eyelids done or anything. No one sees this except for you and your face looking at that job every day. And they're going to make you, just because no one else is looking at it, doesn't mean that they're not going to do their best to make it perfect. I've spoken to people that have had cancer and not even knowing them from Adam, you bump into someone in the grocery store and you know what they're going through, and when I hear, oh, Dr. Baker, oh, you're in good hands, oh, or Dr. Shem, oh, don't worry about it, just get through it, do your best to get through it, because I know firsthand that the doctors and what I call their little angels, they're all going to be your backup to get you through everything, and you're going to be fine. You will.